Hi, Dr. Dave here, your New York City chiropractor and Director of Synergy Wellness, Chiropractic, and Physical Therapy in the East Village in Manhattan, New York. Here, we're going to talk about everything cold laser therapy. There's a lot of different terms that are floating around out there, like low-level laser therapy, LLLT, deep tissue laser, photobiomodulation, PBM, all terms that are used for cold laser therapy. And finally, I get a lot of questions about LEDs, which are not the same as laser therapy. What's the difference between lasers and LEDs, light emitting diodes? One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you. There are many light-emitting products on the market today claiming to be lasers that don't meet scientifically defined attributes for being an actual laser. For example, products that use light-emitting diodes, or LEDs, as they are more commonly known, do in fact produce light. However, the light is not intense, providing very little energy, and is non-coherent. Similar to light produced by ordinary household light bulbs, LEDs are cheap and easy to reproduce. These devices are not lasers. This misconception is in large part a byproduct of marketing. Laser light is unique in that it is monochromatic, coherent, and collimated. These traits make it well suited for many medical applications. The monochromatic or single wavelength beam is ideal for stimulating chromophores in biological tissue that only respond to very specific wavelengths. Coherent photons are organized where non-coherent photons are not. This property is important to minimize photon scatter as light interacts with tissue. Lastly, since injured tissue is normally deep in the body, laser's collimated beam helps focus energy in a narrow, direct path, which is ideal for treating tissues at depth. LEDs usually emit light in a small band of wavelengths, around 20 nanometers wide, but cannot emit a single specified wavelength around 1 nanometer wide. This bandwidth impacts their ability to dial in the wavelength to optimally treat and target desired tissues. Additionally, LEDs produce neither a collimated nor coherent beam, which is less ideal when treating deeper tissues. And lastly, LEDs operate at significantly lower power wattage than most lasers, which impacts their ability to reach deeper tissues in smaller windows of time. When trying to target deeper tissues, wavelength is a critical variable that can play a significant role in the light's ability to penetrate the tissue. But it's not the only determining factor in therapeutic effectiveness. Power is a second variable that also plays a large role in determining both proper use and consistency of outcomes for light-based therapies. Lasers are generally capable of producing much higher powers than LEDs, which significantly impacts their ability to reach deeper tissues. This involves getting an adequate amount of photonic energy to injured tissue to have a photobiomodulation effect. Since a significant amount of light is lost as it passes through tissue, having more initial power at the surface improves the modality's ability to provide adequate amounts of energy at depth. For superficial uses, such as wound healing, therapeutic effects can be achieved with a minimum amount of energy applied to the surface, for which LEDs are well suited. But for deeper or more widespread conditions, such as fibromyalgia or chronic low back pain, a greater amount of energy must be delivered for a sufficient therapeutic effect to be achieved. It's crucial for the doctor to know how to use cold lasers. It's not just about point and shine the light where it hurts. There are specific wavelengths that target different soft tissue at different depths in different areas. And they also have different therapeutic effects. Proper diagnosis, so you know what tissues to target and with what wavelength is optimal for that tissue, as well as the dose time. A muscle spasm or trigger point, for example, would not get the same wavelength as repairing a partially torn Achilles tendon or a rotator cuff muscle. Practitioner equipment, knowledge, and laser skill is just as important to get the best results. I've been using cold lasers in practice since around 2011. It has transformed the way Synergy Wellness in New York City treats nerve and soft tissue injuries. As the technology improves, so does the research. I stay on top of the latest research and laser protocols by being an active member of Laser Therapy University and having the best cold laser therapy equipment on the market. It doesn't get any better than this portable MR5 Active Pro laser with detect and dose technology. I can switch this laser from 25 watt to 50 watt at the press of a button. It's a super pulse laser with options of different light spectrums and wavelengths measured in nanometers. This laser uses a scan mode and can actually detect areas of soft tissue inflammation and damage underneath the skin and give it the exact dose of photobiomodulation the tissue needs to speed up the healing process. And we have tested this feature. It's amazing how accurate it is. The million-dollar question: how does low-level laser therapy or cold laser work? Unlike high-power lasers that use heat and destroy tissue, for example, surgical lasers, low-energy lasers affect the cellular energy of the underlying tissue. Cold or low-level lasers stimulate function down to the cellular level. Low-level laser light is compressed light of a wavelength from the cold red part of the electromagnetic spectrum. It's different from the natural light in that it's one precise color. It's coherent, it travels in a straight line, monochromatic, a single wavelength, and polarized. It concentrates its beam in a defined location or spot. These properties allow that laser to penetrate surfaces of the skin deep with no heating effect, no damage to the skin, and no side effects. Instead, laser light energizes the body's cells, in which the cells then convert into chemical energy to promote natural healing and pain relief. So how does laser therapy work? It's a scientific fact that light transmitted to the blood has positive effects throughout the body, supplying vital oxygen and energy to every cell. The effects of low-level laser treatments are photochemical. A photon enters the tissue and is absorbed in the cell's mitochondria and cell membrane. Mitochondria are parts of the cell found in the cytoplasm. They make most of the cell's supply of ATP, which is the molecule that cells use as a source of energy. This means mitochondria are known as the main powerhouse of the cell. Inside the mitochondria, the photonic energy is converted to electromagnetic energy in the form of ATP, adenosine triphosphate. Cell wall permeability increases, causing physiological changes. These physiological changes affect fibroblasts, macrophages, mast cells, bradykinin, endothelial cells, and nerve conduction. The physiological and clinical effects are obtained by how tissues absorb laser. Tissue absorption depends on the wavelength of the laser, the power to assure that laser energy reaches the targeted tissue, and the proper clinician protocols by an experienced doctor. An improper wavelength of laser light will not penetrate the tissue to reach the desired target area. However, a proper wavelength will speed healing and recovery time by 40 to 50%. The most common conditions treated with cold or low-level laser therapy are acute and chronic neck pain, back, knee, ankle, shoulder, elbow, wrist, hand pain due to soft tissue injury or repetitive use disorders like carpal tunnel syndrome, migraine, headaches, tendinitis, arthritis, soft tissue strains and sprains, nerve irritation, inflammation reduction, enhanced tissue wound healing, and cell regeneration. We've had incredible success treating serious neurological disorders like epilepsy, occipital, trigeminal, or facial neuralgias, Check out our epilepsy video, a life-changing story of a young woman with daily seizures that went 6 months seizure-free, headache and vertigo-free, all because of cold laser therapy. Or check our other video out, Bell's palsy, a patient that had facial paralysis. Every day now, there's new research coming out on subjects like healing periodontal gum disease with laser. The benefits are wide-ranging, and I'm excited to see what the future holds. Another common question I get, are there any side effects? There are over thousands of published studies, and not one of them mentions any adverse side effects of diode lasers. Low-level lasers are safe, non-toxic, and non-invasive. There has not been a recorded side effect in over 1,700 publications. Some necessary common sense precautions need to be considered, such as avoid pointing the laser in the eyes directly or pointing it over the thyroid directly. What makes one laser different from another? A laser can differ, as we spoke about, in its wavelength and power source or wattage, or whether it's a continuous or pulsed waveform. Pulsed is a technology safer and easier for the healthcare practitioner or professional to administer. Cold, low energy, or low level lasers are used to increase metabolic activity down to the cellular level through non-thermal reactions. So what is a wavelength, and do the different wavelengths matter? Light is measured in wavelengths and is expressed in units of nanometers. Different wavelengths, as I said before, have different energy levels and can have various effects on tissues. So a big yes, it does matter. The other question I get is, how long are the treatments? Treatments can vary in time from 10 to 20 minutes, depending on the condition. Research studies show that there may be a dose-dependent response, so it may be more useful to treat at lower doses at multiple intervals than to address a single time with high dosage. How long does the therapy last? A therapy plan may vary depending on the condition. For instance, an acute soft tissue injury or open wound may require multiple short treatments initially, then intervals spreading out between treatments as the condition improves. Somewhere between 5 to 15 treatments over the course of a few weeks is typical, but each case is different. Here are some clinical benefits of cold lasers or low-level laser therapy or photobiomodulation. Improved cellular metabolism, improved blood circulation and vasodilation, pain relief or having an analgesic effect on the body, anti-inflammatory effects, stimulation of wound healing at a much faster rate. It also relieves acute and chronic pain, and also increases the speed, quality, and tensile strength of the tissue that you just repaired. It can stimulate the immune system when used properly, and also stimulates and can inhibit nerve function, depending on the wavelengths that you use. It also develops collagen and muscle tissue. It helps to generate new and healthy cells and tissue. It promotes faster wound healing and also clot formation. So as you can see, there are a lot of uses for cold laser or low-level laser therapy. Many acute and chronic conditions can be improved or eliminated with cold laser use, including pain relief, wound healing, arthritis, migraine headaches, lower back pain, neck pain, repetitive stress injuries, carpal tunnel syndrome, tendinitis, like golfer's elbow or tennis elbow, sprains and strains, fibromyalgia, jaw pain, soft tissue injuries, sciatica or any nerve impingement syndrome, disc herniations and bulges, spinal stenosis, and much more. If you have any questions about cold laser therapy or whether it's the right fit for your problem or your condition, just comment below. Thank you.